Hello everyone. I am a little assistant professor from the Department of Pharmacognosy, Sri Shanmuga College of Pharmacy. This is part two of our lecture on adulteration of a crude drug. In part one, we have discussed the meaning of adulterations and reasons for the adulterations and the conditions of the adulterations. I hope you were able to follow the part clearly. In today's session, we are going to continue with the very important sections, that is a type of adulterants. Okay, this part is extremely important for the exams and vivas and understanding how adulteration actually happens in the market. So, let's continue from there. Okay, so till now we understand why adulteration happens and under what conditions it occurs. Okay, so now the question is, in what ways do people actually adulterate crude drugs? That is what we call type of adulteration. Okay, so each type shows a different method of adulterations. So some are simple, some are clever, and some are very dangerous. So I'll explain one by one with examples in a simple way. Okay, so let's start with the first type is substitution with the inferior commercial varieties. Okay, so here the adulterants belongs to the same group or same genus, but it is inferior in quality. Okay, so why is this type very common? Because of morphological resemblance to the naked eye. When you see the glue drug, it leaves this that plant leaves look similar. Sometimes the seeds look similar, sometimes the root looks similar. So inferior varieties are easily mixed or substituted. Okay, so inferior varieties are, for example, for the example of inferior commercial varieties, Senna. Okay, so true Senna is a Kezia Senna. Okay, but in the market you may find Arabian Senna, Dark Senna, and Avaram Senna. So all look similar, but the therapeutic activity is not that much same. Okay, so another example is ginger. So medicinal ginger is a Gingiber officinale. We can say Gingiber officinale, but Gingiber myoga in sometimes we used as an adulterant. So the drug looks genuine, but the effect is reduced. So this type of adulteration is very difficult to detect without proper evaluation. So now let's move on to the intentional type of adulteration. Here, substances are artificially manufactured to look like the original drug. Okay, so the main aim is to copy appearance, shape, color. Okay, so for example, artificial invert sugar instead of honey, and paraffin wax in colored yellow instead of a beeswax, and basswood instead of a nutmeg, chicory instead of coffee berries. Okay, so at first glance, everything looks correct. Okay, but chemically and therapeutically, these substances are completely inferior. So this type of adulteration clearly shows planned cheating. Okay, so next is about the substitution by exhausted drugs. Okay, so this is one of the most common adulteration practices roaming around in the herbal industries. So here the same plant material is used, but it is already exhausted. Okay, so that means active constituents are removed and the essential oils are extracted. Okay, so what remains is just inactive material. Okay, so this happens commonly with the clove, fennel, ginger, and cascara sagrada. So sometimes after extraction, the leftover material is recolored or flavored to make the look the crude drug genuine. So visually it looks original, but therapeutically it is useless. Okay, so this is silent and very clever type of adulteration. Okay, so next is type 4 of adulterant. In this type, the adulterant is natural substance, but it has no relation to the genuine drugs. Okay, so first of all, type 4 is substitution by superficially similar inferior natural substances. Okay, so adulterant is a natural substance, but it has no relation to the genuine drug. Okay, so it is selected only because of its looks similar. Okay, so examples are Alianthus leaves instead of a belladonna, senna or mint, safflower mixed with the saffron, so peach kernel oil mixed with the olive oil. So here the substituted drug may not have the record therapeutic effect. So treatment fails and patient loses the trust. Okay, so next is type 5. So addition of a synthetic principle. Okay, so in this type, synthetic chemicals are added to the natural drugs. Okay, you can ask why. So it is to improve the smell, taste, and also chemical test result. Okay, for example, citral added to the lemon oil. Okay, so benzyl benzoate added to the balsam of Peru. So the drug may smell strong and appear genuine, but it is no longer purely natural. Okay, so sometimes these synthetic chemicals may causes the irritation, allergy, toxicity, so some side effects. So this type is dangerous in the long run. Okay, so this type is dangerous in the long run. Okay, so next is type 6, adulteration using vegetative matter of the same plant. Okay, so here parts of the same plant are used as a adulterant, but those parts have no medicinal value. Okay, so examples for this type of adulterants: stems mixed with the leaves, wood mixed with the barks, and mosses or epiphytes mixed with the bark drugs. Okay, so this commonly occurs in drugs like cascara, chincona, and loblia and stramoni. Okay, sometimes it may be accidental, sometimes it may be intentional to increase the weight. Okay, so either way, potency is reduced. Okay, so type 7. Okay, type 7, adulteration with a toxic material. Okay, so this is the most dangerous form of adulteration. Okay, here toxic materials are used. For examples, stones inside the liquorized roots wells, and the limestone species in asafoetida, and the lead shot in opium. So glass pieces in colophony, and barium sulfate in cochineal. Okay, so these material increases the weight and profit, but can causes the serious health hazards. So this type of adulteration can lead to the poisoning and severe, sometimes severe organ damages. Okay, so this is not just unethical; it is a kind of criminal. Okay, so